psychiatry is struggling. So what have some of my colleagues done? So some of our colleagues have joined this toxic psychiatry. Recently at the American Psychiatric Association, I was confronted by many of these protesters. So we have the public who've been hurt by psychiatry, and we have our colleagues, many in the field of integrative medicine, joining this toxic psychiatry where people believe that a psychiatrist, or particularly child psychiatrists, we sit in a room and we decide how we're going to hurt children with psychopharmacology. And this does not help our patients. I think it's both misguided and tragic, and that's part of what I want to address. It's how do we balance some of the negative outcome in research study with some of the rage and anger about psychopharmacology. So the first way I would like to address this balance is the complete neglect of trauma. And one of the things that our integrative clinicians have not done a great job, and our psychiatric colleagues have not done a great job, is really missing and treating trauma. So the tragedy, certainly this was a movie that came out with the Catholic Church sexual abuse based on in the 80s and 90s, but the story continues, over $4 billion and increasing. And then, within the last couple months, this incredible report from Pennsylvania. So trauma is undertreated, underreported, and certainly one of my concerns about our integrative community and colleagues is some patients walking into my office with histories of trauma, and our integrative colleagues not asking the right questions and just recommending vitamins. We know adult survivors of trauma much higher likely of physical illness from heart disease, obesity, cancer, smoking, substance abuse, depression, and suicide. And the suicide is quite dramatic. Childhood abuse associated with future suicidal behavior. A study of almost 5,000 adults followed for 3 years in the Netherlands. Substance abuse epidemics like suicide throughout the country. It's a study in Australia. Those with trauma had both, here you see 40% severe abuse, almost 35% moderate abuse. And then what do we do with our patients with trauma and PTSD? Well, this is the beginning of really a sad state of our treatment model, where doctors and lawyers and judges are granting euthanasia for those suffering from PTSD because we have not found the tools to treat trauma. Okay, a sexual abuse victim in her 20s, according to Dutch Euthanasia Commission, was allowed to take their own life. And in my world of eating disorders, we have case studies from around the world. There's more, but here's some of them: the US, New Jersey, Belgium, Netherlands, as well as some cases in Canada, where these are individuals with anorexia nervosa. Some also had trauma, but in these cases, judges granted euthanasia because of our inability to treat anorexia nervosa. These young kids, 20 to 44 young women, were allowed to die because of our poor treatment. So as integrative clinicians, I believe we have an obligation to begin to really address trauma as a core part of our model, and I believe it has not been front and center in our integrative functional medicine models.